will observe 1 minute silence to the departed soul of IPHE members and their family members, those who have passed during these years. Please. Dr. Nilan Subhushan Basu, Vice President of IPHE India, to give the welcome address.
I would like to welcome you all most heartily. Particularly, I am grieved for the loss of our stalwart members and beloved patrons and all that last financial year. Particularly our past president, our past patron, Dr. Vindeswar Patel, Professor Na, Mr. Shishi Niyoli, and many others. And I am sure many others whom I cannot name, I know them personally, and that really gives me a little heavy heart situation. In spite of the fact that we have assembled here and we will deliberate for the day long, and I am sure that we would have a good stride for inducting new blood in our system, which we are lagging very much. Otherwise, we will keep decaying in years to come. Thank you so much.
Engineer Ashish Sen, Vice President of IPHE Kolkata Center and Council Member of IPHE India, to read out the minutes of the last AGM held on 17th November 2025.
To read out the minutes of the 15th AGM of the IPHE Headquarter, that is India, held on 17th November 2024 in this auditorium. The meeting, I am reading out the minutes. The meeting started at 11 a.m. with Dr. Dinesh Chand, President in the chair. He is in the virtual mode. He was present in virtual mode. But it was seen that the number of members present was less than that required for quorum as per the prevailing clause of the Constitution. As such, the meeting was adjourned, and the adjourned general meeting started at 11:30 a.m. Members present, Dr. Dinesh Chand, President IPHE India, was in the chair in virtual mode in the adjourned meeting. Number 2, 60 corporate members attended the last year's AGM. Number 3, 12 corporate members attended the meeting in virtual mode. At the outset, Engineer Vasishtha Kumar Sengupta, former Secretary General IPHE India, proposed a condolence in memory of the members of the institution who expired during the period from April 2023 to March 2024. Members present observed 1 minute silence as a mark of respect to the departed souls. Thereafter, the meeting was initiated with a welcome address by the Vice President, Professor Orunabo Majumdar. In his address, Professor Majumdar, President, briefly mentioned of the various activities undertaken by the institution to awareness generation programs, training, etc. He further mentioned that the institution, having remained functional for the last more than half a century itself, is indicative of the fact that it was a strong foundation and a sustainable activity domain. He called on the members of the institution to continue to extend their support and cooperation so that we can take our beloved IPHE to newer heights. Then coming to the point number 1. confirmation of the minutes of the 49th AGM held on 26 November 2023. The minutes of the 49th AGM held on 26 November 2023, which were circulated to all the members earlier, were read and confirmed after brief discussion, clarifying some minor points raised by the members. Number 2, presentation of the annual report for 2023-24 by the Secretary General, followed by discussion and adoption. Shri Somir Kumar Mukherjee, Secretary General, presented the annual report for the year 2023-2024. In his report, Secretary General, while welcoming the members present, mentioned sad demise of a few of our esteemed members during the year 2023-24. He shared grief and sorrow with the families of the departed members. During the year in question, 20 fellow members, 24 members and 6 associate members enrolled themselves as corporate members of the institution. As regards financial scenario of the institution for the year 2023-24, Secretary General mentioned that the financial deficit was of the order to rupees 1,64,000 for the year 2023-24. This indicates considerable recovery in the financial condition from the previous year, when the deficit was as much as rupees 10.74 lakhs. In his report, Secretary General further mentioned that an amount of rupees 1.83 lakhs approximately still remained unpaid from Government of India for conducting CPHWO sponsored refresher course in Public Health Engineering. Installation of a lift in IPHE building has been a priority issue, and after lot of deliberations and considerations of various options of the work, it was decided that the lift will be installed in the location as shown in the sanction plan of the building. Secretary General in his report also mentioned of the different events organized by IPHE Headquarters Office and the regional centers during the year 2023-24. In conclusion, he thanked the President and the Council member for extending their wholehearted cooperation in running the affairs of the institution. The report was adopted by the House after discussion and clarification of a few points raised by some of the members. Point number 3. Presentation of financial report for the year 2023-24 by the Treasurer. Proposal for appointment of auditor for the year 2024-25 and fixing up of their remuneration. Sri Probir Bose, Treasurer, presented the audited accounts for the year 2023-24 and explained some of the salient features of the financial scenario of the institution during the year in question. Among the points highlighted by the Treasurer were: in the auditor's report, there are no critical or advanced comments or suggestions. Then, excess of expenditure over income for the year 2023-24 was rupees 1,64,000 approximately, as mentioned above. There was no pending advance to the recovered. Then, approximately rupees 5,24,000 was earned as bank interest from fixed deposit of value of rupees 87 lakhs approximately and savings bank accounts with the banks. The declining rate of interest in bank fixed deposit is a matter of concern as bank interest is a significant component in our total income. Then approximately rupees 5,38,000 was received as donations predominantly comprising user charges received against occupation of the ground floor auditorium, second floor lecture theatre and second floor meeting room. Then during the last 2-3 years there have been hardly any training, R&D, oblique consultancy assignment which are important source of resource mobilization. The headquarters building is getting old and the cost of routine maintenance is prohibitively increasing. A large amount of, that is rupees 1,83,526 towards reimbursement of the cost of CPHO sponsored training courses lying unpaid from Government of India. With the approval of the Council, the Treasurer proposed that Messrs. Pradeep Kumar Dotto and Company 30/30/1-A Hare Krishna State Lane, Kolkata 50 may again be appointed as auditor for financial year 2024-25 with a fee of rupees 18,000 plus GST as applicable. Discussion on financial report including the appointment of auditor, their remuneration and adoption. After some points raised by the members present and clarifications of the same by the Secretary General and Treasurer, the financial report for 2023-24 was approved and adopted. Then election of IPHE Council for the term 2025-26. After completion of extended tenure of 2 years election to the IPHE Council for the term 2025-26 is to be conducted during the month of March 2025 so that the new council could take over from April 2025. Sri Bodhisattva Sarkar was appointed unanimously by the council as election scrutineer and Sri Ratneshwar Mojumdar as joint election scrutineer. Preliminary actions for conducting the election have already been initiated. Point number 6, open house discussion. Taking part in open house discussion, some members present in the meeting, mainly Sri Ranjit Kumar Sengupta, Sri Deepak Kumar Sarkar, Dr. S.K. Das, Sri Borun Kumar Bosak and others raised issues like names and members who expired during the previous year, breakup of expenditure heads like service charge and travelling expenses, parking of large amounts of funds in savings bank account, expenditure effort in installation of lift in IPHE office and other issues. It was clarified that as we do not have specific information about members from across the country who expired during the previous year, it would not be justified to mention specific name, as in that case some names may be left out which will not be fair. Regarding parking of funds in savings bank account, it was clarified that expenditures that may be required to the incur in near future are only parked in savings bank account. Treasurer also explained the breakup of expenditure heads like service charges and travelling expenses. Regarding installation of lift, the latest update was shared with the members present. The representatives of Bengaluru Regional Center and Agartala Regional Center who were present mentioned of the proposed activities of the center in the forthcoming months. Then point number 7, address by President Dr. Dinesh Chand. At the outset, Dr. Dinesh Chand, President IPHE Headquarter, appreciated the opportunity to take over as President of our esteemed institution. He expressed heartfelt gratitude to fellow council members and office bearers. He particularly cited the names of late Professor K.J. Nath, past President, and late Sri S.K. Niyogi, past Secretary General and Founder Secretary General also in this reference. He also paid his tribute to late Dr. Bindeswar Pathak, who have been our mentor and advisor for a long time. As constituents of this institution, it is our responsibility and honor to enhance the reputation and contributions of the public health engineering community, particularly in the field of public health and environmental services. In today's world, we are confronted with an unparalleled array of public health and environmental challenges. From the far-reaching effects of climate change impacting entire continents to localized issues affecting our communities. The imperative for action has never been more urgent. These challenges extend beyond the purview of public health and environmental engineers. They encompass the entire engineering community. It is incumbent upon us to actively immerse ourselves in comprehending, alleviating and addressing these issues, leading the change with expertise, proficiency and ingenuity. Dr. Dinesh Chand also mentioned of the following suggestive activities as bridging the gap between technical solutions and community needs. Number 1, engage with local schools, colleges and community centers. Then organize workshops and seminars. Then utilize social media platforms. Then collaborate with local government. Then and lastly, foster a sense of environmental stewardship. Dr. Chand also urged all corporate members attached to the regional centers scattered nation-wide in actively participate in the activities of the institution and revitalize these centers. He called upon the executive committees of the regional centers to commence training programs which would cater the knowledge needs of engineers, technicians and as well as technical supported staff. As regards priority activities of the institution, President mentioned of upgrading the constitution, publications, infrastructure improvements, student membership drive and enhanced digital presence. He concluded his presentation by urging the council members to persist in their commitment to our institution, mirroring the dedication demonstrated in the previous years and gratefully acknowledge
Give your consent. Oh, most of the members have given their consent. So confirmed of the last year AGM. Okay. Minutes of the last year AGM. Now I would request our Secretary General S.K. Mukherjee
Gathering
for
and place
presentation.
before you the annual report of IPHE for the year 2024-25. During the year in question, we had lost a few of our esteemed members who enriched IPHE through their experience and wisdom. We remember them dearly and pay our respect to the departed souls. We also share grief and sorrow with the families of the departed members. During the year 2024-25, we had enrolled 6 fellow members, 17 members, and 10 associate members, aggregating to 33. We had also enrolled 1 organization member during the year. As regards financial scenario of the institution, the year 24-25 was not very encouraging compared to the previous year. While the details of the accounts for the year will be presented by our treasurer, it may be summarily mentioned that the financial deficit for the year was of the order of rupees 1,95,000 approximately, as against rupees 1,64,000 for the year 23-24. Due to various financial compulsions, we could not only recover the financial deficit of the previous year, but also had to incur further deficit of rupees 30,000. As such, our endeavor of restricting expenditure strictly by adopting austerity measures, as well as wholehearted drive for mobilization of resources, should continue if we achieve a positive financial balance in the year 25-26, that is the current year. I am happy to state that the outstanding dues from CPHE or Government of India for conducting sponsored refresher courses in public health engineering for 3 consecutive years from 2016-17 to 2018-19, amounting to rupees 1,83,000 approximately, could finally be realized from the Government of India after effort from our end. Installation of a lift in IPHE headquarters has been a priority issue, and we started construction of the lift as per sanction plan in the IPHE office from December 2024. But due to various compelling situations beyond our control, the work of installation of the lift was interrupted in multiple occasions in spite of our best efforts to follow up with the agency for expeditious pace of construction. The lift shaft has been completed, as you might have seen, and machineries are under installation. We hope the work will be completed by December 2025, and in the new year, our senior members will have the pleasure of traveling to the upper floors of the office in the lift. The annual general meeting of the institution for 2023-24 was held on Sunday, the 17th November 2024 at IPHE office. 72 corporated the meeting physically and virtually. During the year 2024-25, IPHE headquarters organized several programs like the World Health Day 2024, theme of which was My Health, My Right, on the 8th of April 2024. World Environment Day 2024, for which the theme was Land Restoration, Desertification and Drought Resilience. It was held on the 8th of June 2024. Professor K.J. Nath Memorial Lecture on 29th October 2024. The lecture was delivered by Professor A. Mojumdar, Vice President IPHE, the then Vice President, on the subject arsenic contamination in groundwater, issues and challenges. First, Shishir Kumar Niyogi Memorial Lecture was held on the 29th January 2025, delivered by Sri Chandan Sengupta, former Project Officer, Water and Sanitation, UNICEF, former chairman, Sanitation Task Force, Government of West Bengal, on the subject on-site sanitation. Public Health Engineers Day was observed on 9th of March 2025. Keynote speaker was Sri Tonoy Kumar Das, former Chief Engineer Civil, Northern Zone, PHE Directorate, Government of West Bengal. The regional centers of the institution during the year 2025 also organized the following events. Delhi Regional Center organized Engineers Day on the 15th September 2024. Kolkata Regional Center organized a popular talk on conflicts between environmental and social issues in Sundarban by Professor Gopinath Bhandari of Jadavpur University on 6th September 2024. Kolkata Regional Center also organized a technical talk on sanitation problems in hilly congested areas, a habitual issue, by Parthojit Patro, and insights from wastewater testing for surveillance of COVID-19 outbreak from Bengaluru, potential for future application in other cities, by Paramita Basu, and in virtual mode from USA on the 11th of December 2024. Kolkata Regional Center organized a national seminar on technology advancement in the field of water supply, wastewater and solid waste management for a sustainable future on 7th and 8th of March 2025. Bengaluru Regional Center observed World Water Day, World Meteorological Day simultaneously on the 22nd March 2025. Kerala Regional Center observed World Water Day on 22nd March 2025. Guwahati Regional Center, in association with IPHE, observed World Water Day on the 22nd March 2025. And in addition to this, there are some programs organized by other regional centers which may be missing in the small list that I mentioned right now. Agartala Center also organized some programs. I take this opportunity of thanking the President and all the council members for extending their help and cooperation.
Good morning, members.
For this.
This is my first presentation of the Treasurer's report, being Treasurer of IPHE. So a written report has been circulated to all of you. Hope you have gone through, but I will read it line by line. So dear corporate members, greetings in the festivities around and Shubha Vijaya and Shubha Deepavali. It's my immense pleasure to place the audited accounts for the financial year 2024-25 of the institution before you during the annual general meeting being held today. The audited accounts, combined with the same received from the regional centers of Kolkata, Delhi and Bengaluru, with details as appended here with other regional centers like Agartala and Thiruvananthapuram, who has also been taken as reaction for opening bank accounts with a PAN card, and institutions shall join in team in near future. However, the audit report that we have circulated to is the standalone report. It is not in combination, so also whenever you will be going through, it is the standalone of the headquarter only. It's my pleasure to share the salient features of the financial issues and the audited accounts for your reference and record place. The institution has made an appeal to all our organizational and corporate members to generously contribute to raise a fund of Rs 50 lakhs for the purpose of facelift and refurbishment as well as extension of the headquarters building in Salt Lake, Kolkata. Your participation in general donation for the cases will be highly appreciated, and I am glad to inform that already you have contributed more than 65,000 in this journey, and we are hopeful that you will be coming forward in the recent past. The institution has taken few more initiatives to improve the financial capacity by way of upward revision of the membership charges, advertisement tariff and utility charges of the facilities including the auditorium, available for the general users. So we'll come back in details in the agenda item in the miscellaneous part. We'll discuss in details on this. The institution has also started exploring other sources, including government or semi-government fund available under CPHU, then SPM Nivas means Jal Shakti Ministry, and also the state government West Bengal to organize different training program, and also under CSR to be taken up in near future. Already we have appealed Indian Oil for CSR support. The available assets, including the fixed deposits, except for the fund required to install the lift out of the dedicated fund received from late Padma Bhushan Vindeshwar Pathak for an amount of 20 lakhs is being maintained with the target to increase the same in future, and with your wholehearted support and good wishes. The updated account indicating expenditure over income for an amount of rupees 1,95,366 has been triggered out of a comparatively lesser amount income in the way of advertisement for the journal JIPHE, because we have received only 88,000 during the last financial year, for which the ST members are requested to come forward with all possible support towards collection of advertisement for the journal, newsletter and our website. We also published advertisement in our website. Lastly, I would like to invite your valuable advice, and this is most important. Kindly advise how best we can improve in our financial picture in the coming days, and feedback to make the institution financially independent and resourceful to undertake many more activities in the field of public health and engineering in future. Jai Hind 180. Less expenditure over income, that already mentioned by the Secretary General and in my report also, that is 1,98,366. So putting all together, then building fund that we have received during the as on 31st March 2024 was 1,11,220. And then the current liabilities was the accounting charges and audit fees and other professional fees. So putting all together, it was coming to 1,12,42,640. Now coming to the asset part, the fixed deposit is given in the schedule A in details. It was fixed assets, sorry. It is 13,56,167. Then work in progress means particularly against the lift, whatever payment was made, that was considered also against the fixed asset, 2,11,000. Then the current asset was the security deposit, that schedule B is there. So it is 1,15,228. Accrued interest was 74,294. TDS receivable was 53,276, and advance to staff was not there. But fixed deposit as per the schedule C was 87,41,691. Cash in bank balance, including cash in hand, it is given as cash in hand 38,000. Bank account, we have 3 bank account, active account, and another zero balance account is there, so it is not included. Punjab National Bank was 1,62,993. State Bank of India 1,05,088. Bank of Baroda was 2,60,840. So putting all together, it is 1,10,74,573 and 47 cents. Coming to the expenditure and income part, expenditure was like this: service charges, which include the remuneration that is given to the staff and also the office bearers, that is 5,79,369. Gratuity fee was paid for 10,000 to one of our retiring staff. Few points raised by our members, the financial issues that I am responding. Firstly, Mr. Varun Kumar Bashak, we wanted to know that the donation received from late Padma Vindeshwar Pathak for 20 lakhs, how it is being pledged. Am I correct? Mr. Bashak? That was your point. So mostly we are utilizing that fund for installation of the lift, as you know. The budgeted amount the lift is, as on today, it is 14 lakhs 68,000. So roughly 15 lakhs has been kept for installation of the lift. Balance 5 lakhs is being utilized for different facility activity of the building is going on piecemeal basis as of now, because we need more fund for them. We estimated that we need at least 50 lakhs for refurbishment and overall maintenance, facelifting, and also to extend another floor. As you know, we have the approved building plan, and that should be done within the stipulated time period to have a guest house facility on the top of the roof. So putting all together, we estimate that we need 50 lakhs rupees. 5 lakhs is quite minimal to that, and that's why we have appealed to all the members for generous donation. We have also raised some issue on the expenditure over income, particularly about the printing and stationeries, because printing and stationeries involve all kind of printing, including the journal, the newsletter, and also different, particularly about the election process. As you know, last year the election was there. For that, there was expenditure was quite high, so that has gone to 80,000 plus, around 90,000. Regarding meeting expenses, yes, now since we are having regular council meeting and also having different other meetings, because of we are now actually extending some of the activities. President will talk about that. Let me mention, Mr. Tahani raised about SPM Nivas. We have visited SPM Nivas, talked to them. They have agreed to sign an MOU with IPHE to conduct some training program. President also in touch with Government of Department of Urban Development to conduct some training program about restarting the course that we are running for the Senate inspectors. So that is in the process. I will tell details about that. And also we got very recent list of the commission from CPHU to restart the training program. So for that we need some more meeting is being conducted, so expenditure is definitely going high because of some extended activities. Postage and stamp, particularly during the election, we had to send the ballot paper by post, and that's why the expenditure was quite high, particularly in that particular financial period. Electricity, which was of 24-25. Normally, depends on the booking. If you see, we have normally the booking of this particular hall, expenditure on user charges is more than 6 lakhs, that was the highest income. So once you reach out this hall for hiring by the private users, so definitely the electricity will go high. So there is a correlation. If the income is low, then electricity will definitely be low. BSNL telephone will take care of that. Since we have surrendered, let us see how best we can recover that money. Mr. Dikadhar has raised that particularly some head of account shown as blank. So this particular issue I discussed with the audited party. They said since the head of account is created, so this was basically for the Golden Jubilee celebration and national seminar during those periods. So these are not being now being utilized, these particular heads. So we cannot take out these heads for 5 years time. We have to maintain it, and once it is done, so it will remain as nil, but it will still continue. And I think the financial part, Mr. Anirban Datta has raised also the issue about the expenditure, audit fees that you have mentioned. Yeah, our audit fee is actually 18,000. This includes the GST that is applicable, and also that particular person is also given the responsibility for quarterly filing of the TDS and all those things. For that also we are paying some amount. Putting all together, it is coming to the
Report of the Secretary General. Almost all the points were covered by Treasurer. One point regarding the question from Sri Vishwajit Das about the voting right of ex officio members of the council. It was discussed in one of the council meetings that since these members are ex officio members by virtue of their position as chairman of the regional centers, voting rights cannot be assigned to them. So beyond that, there was no further decision and no discussion. on this particular issue. Regarding bank account opening, treasurer has covered. We had given all the documents necessary for opening the bank account at Kerala Center. And it was up to the Kerala Center to let us know if any more supporting documents are required to be sent from the headquarters office.
So now we can go for the confirmation of the Secretary General's report and audited accounts and treasurer report. If you agree with these confirmation of both the agenda, please raise your hands to give that necessary consent, please. And from on site, thank you very much. So now proposal for appointment for the year 25-26 and fixing up their remuneration. I would request the treasurer, if you have any specific proposal, please.
Mrs. Pradeep Kumar Datto and Company, 30/1F, Eric Krishna Lane, Kolkata, 7,750. Will again be appointed as auditor for the financial year 2025-26 with the same fee of 18,000 plus GST as applicable. Besides, we also sought a clarification from them to opinion about GST registration of IPHE. Because this was raised in our council meeting. So, reply we have received, as we have received from the auditor, is circulated to you all. So, what he suggested that we can conclude that the institution have a non-profit motive and therefore he may not go for this GST registration. So this proposal is before you, the consideration
Members are present in today's annual general meeting physically and virtually. From me, Namaskar and Abhinandan. Institution of Public Health Engineers India is a premium forum of public health and environmental engineers of the country. Established in 1972 as a modest society, today IPHE has spread all over the country, having 15 regional centers at different locations and headquarters at Salt Lake, Kolkata. However, a few regional centers need rejuvenation. At present, valid membership strength of IPHE India is around 1500 out of total enrollment of around 3000 in different categories like fellow member, associate member, organization membership, member. Organization membership is in a separate category is open to organizations and institutions who are involved or interested in public health engineering or environmental engineering. The institution has got a diversified spectrum of activities like organizing conferences, seminar, symposia, workshop, technical paper meetings, training courses, awareness and sensitization programs, research and development study, etc. Regular publication of technical journal is also another important activity of IPHE India. Public health engineers play a crucial role in safeguarding community health in India by conducting engineering, by combining engineering principles with public health objectives. Public health engineers' work directly support national priorities such as safe water supply, sanitation, pollution control and disease prevention. IPHE India is one of the key resource centers of Central Public Health and Environmental Engineering Organization, Ministry of Housing and Urban Development, Government of India, for organizing training program for in-service public health engineers of the country. During the last 5 years, no training courses were conducted under CPHEO program. However, recently CPHEO initiated to start training program again with new guidelines and policy. IPHE India submitted proposal for organizing a good number of training programs relating to water supply and wastewater management. It is understood that IPHE will have to prepare training module on different topics before commencement of training program. We have received communication that we have to conduct 6 training courses from 2025, 25th December, I think they have mentioned, and accordingly we have to prepare training modules. Regarding Shama Prasad Mukherjee National Institute of Water and Sanitation, that has been installed in Kolkata by Ministry of Jal Shakti. They are organizing very many training programs on water and sanitation. IPHE contacted SPM Nivas, Sri Kripan Rai and AB Pal from IPHE visited SPM Nivas, and they have proposed that IPHE can collaborate with SPM Nivas for conducting training program. Many of the members of the IPHE is now connected to SPM Nivas for conducting training program. A suggestion has come today with respect to collaborating with different institutions, private institution, engineering institution, including IIST as well as Jadavpur University. We have to explore this particular proposal. If possible, definitely we can collaborate with the engineering institutions for developing, in faculty development program as well as supporting their training program. IPHE headquarter is facing financial crisis due to increasing building and infrastructural maintenance cost. Further funds are required for building repairing and coloring, ground floor auditorium renovation, installation of new audio-visual system for the auditorium, and development of a new council meeting room. In urban local bodies, sanitary inspector play significant role in the process of delivering different civic services to the citizens. In past, IPHE conducted academic course on sanitary inspector, but it was discontinued due to some reason. Now we are thinking to revive academic course on sanitary inspector with the approval of Government of West Bengal. Our esteemed member, Engineer Pradeep Chakraborty, today raised the issue of starting the plumbing course because he considered, and we also considered, there is a great demand of the plumbers in the society. I propose, or we will be planning to have a subcommittee with the chairmanship of Engineer Pradeep Chakraborty so that we can start this particular training program in near future. Dialogue is on the way with the West Bengal State Urban Development Agency, SUDA, for association of IPHE as providing handhold support or handhold training to small urban local bodies on solid waste management. Corporate members of IPHE on several occasions raised the issue of introduction of electronic voting for IPHE council election. Accordingly, e-voting along with voting through ballot as per option of corporate members is in practice for IPHE council election. Total switching over to e-voting needs to be considered subject to availability of email ID and mobile numbers of all corporate members. I extend my thanks and gratitude to all